Welcome, everyone. My name is Stefan Ramdor, and I'm the chair of the all-volunteer nonprofit organization Medicare for All, Florida. I'm thrilled to welcome you to tonight's Florida Medicare for All Town Hall, co-led by the Students for a National Health Program, Florida. In the next hour and about 10 minutes, we will hear from physicians, medical students, experts, as well as our keynote speaker about why we need guaranteed healthcare for all and what we can do to get us closer to making it a reality. Also, we will share several ways, specifically how to take action with follow-up activities. I would like to thank all of the organizations co-sponsoring this Florida Medicare for All Town Hall tonight, and there are quite a lot. So in a moment, Kenneth and myself will share about all of these co-sponsoring organizations for tonight's event. And so that brings me to one of the members of Students for a National Health Program, who will be our first moderator for tonight, Kenneth. So Kenneth, over to you.
Thank you, Stefan. Hi, everybody. My name is Kenneth Davis. I'm a second-year medical student at the University of Florida and a member of the Students for a National Health Program. Thank everybody for being here tonight. So we're going to go ahead and get started with listing out all the co-sponsoring organizations very quickly. If you're one of these organizations, please give us a shout. First, we want to go ahead and give a thanks to the Orange County, Seminole County, Brevard County, and Broward County Democratic parties, the Coral Springs Parkland Democratic Club, the Osceola Young Democrats, the University of Florida College Democrats, the Democracy for America Palm Beach Chapter, Left of Center, the Central Florida Grassroots Progressives, the Standing Heroes for Average Workers, Sunrise Orlando, the Florida Access Network, Bands Off Miami, Organizing to Victory, the Labor Community Alliance of South Florida, the Central Florida Jobs with Justice, One Payer States, the National Organization for Women Florida Chapter, Florida Rising, Public Citizen, and the Miami Coalition to Advance Racial Equality. Stephen.
Yes, and also in addition, we have co-sponsoring tonight Physicians for a National Health Program, National, as well as the Florida chapter, Students for a National Health Program, University of Miami, as well as Florida State University, Progressives for Democracy in America, Florida, Progressive Democrats of America, National Florida, as well as Central Florida, the Democratic Progressive Caucus of Florida, as well as of Tampa Bay, Orlando Come Out with Pride, the Center for Common Ground, National Active and Retired Federal Employees Association, Florida, Business Leaders for Health Care Transformation, Healthcare Now, Labor Campaign for Single Payer, National Union of Healthcare Workers, as well as National Nurses United. So thank you so much to all of these organizations for co-sponsoring. Kenneth, over to you.
Thank you. We're honored that we will have with us tonight the U.S. Sheila Cherfilus-McCormick of Florida's 20th Congressional District. Representative Cherfilus-McCormick is an enthusiastic co-sponsor of H.R. 3421, the Medicare for All Act in the U.S. House. We'll also hear from community leaders in the fight for health justice who can offer a wide range of perspectives on how Florida can benefit from Medicare for All. And we'll also learn about how activists are building movement power from the ground up to make Medicare for All a keystone issue in progressive politics. In tonight's webinar format, unfortunately, only panelists can speak, but we do want you to interact with us. So please put your name, pronouns, and where you are from in the chat, as well as what motivates you to support Medicare for All. Now we're going to go ahead and move on to the next part here. We want to go ahead. Now I'm delighted to welcome our first presenters of the evening, Helen and Gita. As future physicians, they will give us a brief rundown of what the problem is with the status quo of healthcare and why the answer is healthcare reform. Specifically, universal healthcare is laid out in the Medicare for All Act. Helen is a medical student at the University of Miami, and Gita is a medical student at the University of Florida in Gainesville. Both Helen and Gita are members of Students for the National Health Program, just like myself. So I want to go ahead and give a warm welcome to Helen and Gita.
Thank you, Kenneth. Let me just share my screen here. So as Kenneth mentioned, my name is Gita. I'm a now second-year medical student at the University of Florida.
And my name is Helen. I am a third-year medical student at the University of Miami, and I'm also our SNAP chapter president.
So welcome everyone to Single Payer 101. In this very short presentation, we wanted to give everyone a crash course in single payer and why we are advocating so strongly for it. So first, we wanted to go over the three major categories of how we get healthcare in the US. So the first category is via private insurance, which is a plan provided through your employer or through your union that is purchased individually from an insurance company. The second category is Medicare/Medicaid, which are federal health insurance programs providing coverage to people who are over the age of 65 or with certain disabilities, or who qualify via low income, as in Medicaid. The VA is the third category, which is a nationalized healthcare service that provides healthcare to veterans and their immediate family through specific inpatient and outpatient centers.
All right, so what we're looking at right now probably seems a little bit crazy at first, but essentially this is just a comparison of all the healthcare systems of the wealthiest countries in the world. And in this comparison, they're using metrics like mortality rates, money spent, waiting times, and satisfaction of people in the country. As we can see, countries like Australia with single payer systems like Medicare for all rank very well, as does the UK with the NHS, which is basically what we have with the VA. And so it just shows that we already have these systems in our country. They're just not working for everybody. And as far as the ranking goes, this has been roughly the same for the last 10 years. You know, some of these countries have been swapping places, but the overall strong trend is that despite outspending all the other countries on this list, the US is by far the worst. In fact, our maternal mortality rate is 22.3 deaths per 100,000, which doesn't seem like a lot, but it's actually 3 to 10 times higher than the rest of the countries on this list. And the saddest statistic of all to me is that around 44,000 Americans die every single year. And you heard that right, 44,000 people in the United States die every single year simply because they don't have health insurance, which is why it is so important that we continue to fight for single payer healthcare. And so what we're going to do now is basically compare how we get healthcare in the United States. We're going to have a little bit of a simulation, just comparing, you know, an emergency room visit with an ambulance.
So in our little thought experiment, we have 5 different people who are going to represent the 5 different types of healthcare that you can get. So we have Alan, who's on Medicare, Isabella, who's on the VA system, Morgan, who has private insurance, Ty, who has Medicaid, and Yasmin, who is unfortunately uninsured. So for Alan, who has a Medicare program, cost of an ER visit with an ambulance ride is $0 if he is admitted within 72 hours of showing up to the emergency room, or it's a variable copay.
As far as Isabella, since she is with the VA, she's not going to have to pay anything as long as she is notifying the VA representative within 72 hours. Morgan, unfortunately, with private insurance, it really depends. You know, with private insurance, we have all these really hidden fees like copays and coinsurance. You know, it depends on if the hospital is in network or not. So it could be, you know, a couple $100s, or it could be, you know, the same rate as someone who doesn't have insurance.
Ty, who has Medicaid, similar to Alan, would not have to pay anything for the ER visit or for an ambulance ride if what they present with is deemed medically necessary.
And unfortunately for Yasmin, since she does not have health insurance, she's going to have to pay for everything out of pocket. If she needed an ambulance ride to the ED, it costs, you know, between 700 to a little over 1,000 in Florida. But there have been cases for people going to the ED in an ambulance for life-threatening health emergencies that they have to pay up to $12,000 for that visit. And so now we're at this slide, you know, clearly we have a major problem in the United States, which is causing way too many people to be sick and way too many people to die every single year. And this is why we need Medicare for all. There would be no hidden payments making healthcare inaccessible. And additionally, all medically necessary care would be covered. And this includes dental, vision, substance use and mental health treatment, as well as gender affirming and reproductive care. Next slide. Basically, I just want to address the elephant in the room right now. This is definitely the most common argument that we hear against single payer, just being, how would we pay for it? Well, actually, the proposal from Senator Sanders has it so the vast majority of Americans, while pitching in for this through taxes, would actually be saving money every single year compared to buying health insurance plans. Furthermore, the largest corporations and the wealthiest of the wealthy would finally be paying their fair share without escaping taxes through loopholes. And you can look at the actual specifics for this in the proposition itself. Next slide. And with all that said, we want to thank you for your time and all of our co-sponsors for helping us host this event. We will leave you with this really powerful quote from Dr. Martin Luther King Jr. I know this was a really quick intro to single payer, and it's a very complex topic. So if you have any questions at all, please don't hesitate to email us. And once again, thank you.
Perfect. So everybody go ahead and give a thanks to Helen and Gita for presenting us with a wonderful presentation of Medicare for All and why we would all need it. So now, with that said, I think it's time to go ahead and bring in our first panelist speaker. Dr. Robert Hatch was the Clerkship Director of Family Medicine and Ambulatory Care Clerkship at the University of Florida College of Medicine in Gainesville for 24 years, until just last month where he turned that duty over to his successor. Dr. Hatch actually spent most of his childhood in developing countries before settling in California, where he completed high school in Los Angeles, college at UC Davis, and medical school at UCLA. Not surprisingly, this background plus an MPH degree instilled a strong interest in social justice and a belief that healthcare is a right. Dr. Hatch completed his residency and a faculty development fellowship at the Medical College of Virginia in Blackstone, where his liberalism was kindly tolerated and he learned many valuable lessons from some great attendings. After serving for 3 years in the National Health Service Corps, he joined the faculty at the University of Florida, where he has taught for the last 33 years, receiving several teaching awards. So Dr. Robert Hatch will share a physician's perspective of the problem with the current status quo in healthcare and why a majority of physicians are in favor of Medicare for all. So go ahead and give a warm welcome for Dr. Robert Hatch.
Oh, thank you all very much. Great pleasure to be here tonight. I've been passionate about Medicare for all for a long time and for a lot of reasons. And in the time that I have tonight, I just wanted to go over some of the main reasons why so many physicians are in favor of Medicare for all. So I want to start off at a national level. So let me start by showing a slide. So as you all heard in that first introduction, the US lags behind other industrialized countries by just an embarrassing amount. I'm showing here the slide on US maternal mortality rate, and it shows that we are just way out of line with all the other industrialized countries. So is it because they're richer than us? Absolutely not. Is it because they spend more on healthcare than we do? No, we outspend every one of these countries by far on healthcare. So what is the difference? They all provide health insurance or a national health system to their population, and that just pays off big time. So this isn't just disgraceful, but if you look at these extra Americans who die every year, it's really tragic because with insurance for everybody, we could save an awful lot of lives. And when you're a physician on the front lines, you see this almost every day, and it just makes you really wish we had something better. And the great thing about Medicare for All is it's a super efficient way to get everybody health insurance. And most of the analyses show that we have so many administrative savings by going with Medicare for All that we would not have to increase our total health care funding at all. And we could buy health insurance premiums for everybody. So a really efficient way to get everybody health insurance and to solve this problem with excess mortality that we have in this country. Are you seeing the next slide where it says heart disease deaths? Great. So this shows at a more local level the impact of not having health insurance. So these are maps of Alachua County, where I live and where the University of Florida is. And the top maps show heart disease deaths and stroke deaths. Dark areas have a higher mortality rate, light areas have a lower mortality rate. So if you look on the top left heart disease map, there's an area in the bottom left-hand corner that has a very low mortality rate for heart disease. And if you look over in stroke disease, similar in that area, relatively low stroke deaths. Contrast that with this area on the other side of town, these dark areas, very high rates of heart disease death and very high rates of stroke deaths. So what is it? Why is it that one part of town has quite a low rate and another part of town has quite a high rate? If you look at the lower map, that explains a major reason. So what that map shows is the population in each of these different areas. So these are all census tracts, all these different regions. And the other thing that's on this map is symbols that indicate emergency rooms, urgent care centers, and doctor's offices. So if you look at the area with the low mortality rates, what you find is tons of medical services. And if you look at the area with high mortality rates, virtually no medical services. So why is that? You would think in a logical world where you have the highest death rates that you should have the most medical services, but instead we have the opposite. So the reason is, well, I'll let you think for a second. What do you think the reason is? It is that the people who live here have wonderful health insurance. They're well insured. It pays to put medical services there. The people who live over here have either relatively poor insurance or no insurance. And medical facilities that try to make a go of it over in this part of town go bankrupt. You can't do it because they don't have health insurance. So Medicare for All would fix this instantly. If all the people over here had great health insurance, the same as the people over here, services would gravitate to this part of town. It would solve the inequity with access, and it would go a long, long way to solving the problem with excess mortality in those areas. So Medicare for All would virtually fix that instantly. So the last thing that I want to finish with is a personal level. So one of the things that I have done for several years is volunteer with a group called Remote Area Medical. So it's a group of people who volunteer their time. They show up for a weekend, nurses, physicians, dentists, and I'm proud to say a lot of UF medical students have done it over the years. Great organization. So you hear Remote Area Medical. So where do you think we go? You'd think the Alaskan bush, right? No, Bradenton, Florida, Pensacola, Florida, just north of Orlando. So why is a group like that, Remote Area Medical, going to those areas? It's because in the United States, if you don't have health insurance, in terms of your healthcare needs, you might as well live in the Alaskan bush because you don't have access to healthcare without health insurance. It's just a terrible shame. So Medicare for All would fix that. No American would have to sit around and wait till a group of volunteers comes and offers free healthcare in their community on the weekend in order to get the care they need. Medicare for All would fix that. Finally, one personal story about a patient I saw at one of these weekends. A medical student went in and saw her first and came in and said to me, Dr. Hatch, I just saw a patient who thinks she has breast cancer. And after talking with her, I think she's right. And so I go in to see the patient, and she's cheerful and she's really distressed. And I get this story from her. 4 months ago, she felt a lump in her breast. She thought, hopefully it's nothing because I don't have health insurance. I can't afford this to be something. A month later, it was bigger, and she started to worry and think, what am I going to do? She looked into her options. She couldn't afford anything. A month later, it's even bigger. She's even more worried. And she sees that our group is coming to her town. So she waits 2 months until free health care is available. because she didn't have access to anything else. So by now the lump is even bigger and she's worried. And on examination, it sure felt like a breast cancer. And we arranged for her to have a free mammogram because with the services we offered, that was one of the things we could do. So no American should have to be sitting around pretty sure they have cancer waiting till free healthcare comes to their city. It just should not be something that exists in a country as rich as ours, that has as many resources as ours, and that spends as much money on healthcare as our country spends. So because we ordered her mammogram and it showed a highly suspicious mass, she then qualified to get free treatment for her cancer. But get this, if she instead had paid for the mammogram herself, she would not have had access to that free care. It's just nuts. But our country has so many weird, convoluted situations like that. So again, nobody in our country should have to pay for their cancer treatment for themselves just because they paid for a mammogram themselves instead of getting it through some free county-sponsored system. It just does not make sense, and our country can and should do better. So Medicare for All would solve these and so many other problems, and that's why I and so many other physicians are in favor of it.
Thank you so much, Dr. Hatch. To all of us, it's very great to hear how passionate of an advocate you are, especially to make healthcare a human right and making that into a reality. We're very grateful for you joining us tonight. So now, after hearing from an expert in the medical field, let me go ahead and turn it back over to Stefan, who will share about what activists are doing in Florida to help us get a closer look and get more guaranteed healthcare for all of us.
Yes, thank you so much, Dr. Hatch. That was great. So now we are just about to hear from our keynote speaker, but let me just shift gears for about 2 minutes to share a little bit. This event has been put on by both Students for a National Health Program Florida as well as Medicare for All Florida. So Medicare for All Florida is a all-volunteer nonprofit organization. We have as our mission to educate the public as well as elected officials on all levels of government on the issue of healthcare. The main bills that we advocate for, like as was already mentioned, the federal Medicare for All legislation, as well as state healthcare legislation, such as the Healthy Florida Act. Some of our activities include we are at community events, collecting signatures for Medicaid expansion or also for our Medicare for All petition. We are giving presentations for community groups, which often then also includes, as was mentioned, status quo with healthcare, like how it has so many inequities, so many uninsured, underinsured. And of course, that legislation that was, as was mentioned, the Medicare for All Act of 2023 would expand the Medicare program to cover all US residents and improve the Medicare program to cover all of these services listed, which might not be included in the traditional Medicare today, as well as have no copays, no deductibles, and no other out-of-pocket costs. So it gains in popularity each session. Last time it was introduced, there was 112 original co-sponsors in the US House, including our keynote speaker tonight. And as was already mentioned, 95% of households, according to studies, will actually pay less once we have Medicare for All when it comes to their healthcare costs. And at the same time, the country as a whole would have less expenditures on healthcare compared to the status quo. So when it comes to taking action, we would, of course, like to invite you to join us in our follow-up activities, which we're going to present right after our keynote speaker. So the Patients Over Profits Pledge is one of these campaigns. So it's about candidates or elected officials pledging to not accept donations in excess of $200 from the healthcare industry. So that's a really exciting campaign. All of these candidates that you see here have already participated. Going to be hearing more about that really soon. And then also we have the Medicare for All resolutions campaigns, which we're going to hear more about later. So that's already more than 130 cities and counties all across the country that have passed resolutions saying that they want to see Medicare for All being a reality. So even in Florida here, we had a good number of cities in the county that already passed a resolution like that. So yes, we're going to hear more in just a moment here about all these follow-up activities. But now I have the honor to introduce our keynote speaker. So U.S. Representative Sheila Cherfilus-McCormick was born in Brooklyn, a borough of New York City, to patients from Haiti. Being a proud daughter of immigrants in 2022, she became the first Haitian American from Florida to be sent to serve in the U.S. House of Representatives. Also, she is the first Black woman to represent Florida's 20th congressional district. She earned a Bachelor of Arts degree in Political Science and Government from Howard University and a Juris Doctor from the St. Thomas University School of Law. Also serving as a vice president, later as a CEO of a Florida-based family home health care company. Healthcare is one of her top priority. She's a staunch ally on Medicare for All. Even on her campaign website, it says Medicare for All is a larger push for a universal healthcare system and will be one of my main priorities. So it's only natural how U.S. Representative Sheila Cherfilus-McCormick is also an original co-sponsor of H.R. 3421, the Medicare for All Act of 2023. So everyone, join me in welcoming to the town hall U.S. Representative Sheila Cherfilus-McCormick.
Well, good evening, everyone. Could everybody hear me? Okay. Good evening, everyone. I'm Congresswoman Sheila Cherfilus-McCormick. I'd like to start off by saying a very special thank you to Stefan and everything that you do for Medicare for All. I just want to give you a brief background of who and why I actually got to this point. I actually was a CEO of a healthcare company, but my exposure to healthcare began long before that. When my parents came from Haiti and we were living in New York at first, my uncle was a doctor and he would pretty much try and take care of everybody in the community. So when I would come home, I remember from school, he would have us wipe down the bathroom with all bleach and then try to take care of different people in the community because no one had healthcare. With that, I started seeing the importance of everybody having healthcare because it really, really determined if you had a family structure. I saw too many times that there were fathers, mothers, daughters, children who died because they didn't have the money and the funds to actually get healthcare. But then when I looked at the other side of town, I saw rich families who lived and thrived and they paid for their insurance and it was a totally different situation. So I saw the inequalities firsthand. And then once I moved to Florida, I saw it even more profound. And in that situation, what we were really looking at were health disparities that were based off of your zip code, not just your zip code, but also your race and your gender and just where your life standing was here. And that's when I thought it was atrocious. And at one point, as I was the CEO, I said, well, this is a good opportunity for me to make sure that everybody has access, you know, an opportunity for me to go and talk to members of Congress. And then I started realizing something that people really just don't understand healthcare enough to understand that if we're trying to deal with a lot of the ills in society, it really starts with having parents and family together and not losing them based off of things like healthcare. And it's just about money. That's the only reason why I saw so many families losing their fathers, their mothers, their children. It was about money because we do have the medication and we do have the medical means to save many people. And I thought that was unfair. Right now, I sit on the VA committee, which is Veteran Affairs. And so I have firsthand experience on what having that single payer system looks like and actually its feasibility within the United States. My other committee is also Foreign Affairs, where I'm on Sub-Saharan Africa. And we do a lot of work to ensure that we have healthcare being spread out through Sub-Saharan Africa. But every day I receive messages from my constituents who are struggling to access the care they need, whether it's due to high costs, lack of coverage, or systemic disparities. Today, more than 2.5 million Floridians do not have any health insurance. This staggering number represents real people, our friends, family members, and neighbors who are forced to navigate life without the safety net of healthcare. Tragically, more than 37,000 of these individuals die each year because they are uninsured. These deaths can be prevented if we actually prioritize people over profit. This is why I'm proud to co-sponsor of the Medicare for All Act. I support Medicare for All because I believe is the right path forward for our state and for our nation. Medicare for All would be one of the biggest ways we can leverage equality throughout the entire hemisphere, throughout the entire United States to make sure all Americans have access to a better way of life and also not be driven into debt. Medicare for All will remove the financial obstacles that prevent many Floridians from getting the care they need. The current system, with its co-pays, deductibles, and complex pre-authorizations, discourage people from seeking medical attention in a timely manner. By removing these financial obstacles, the Medicare for All Act ensures everyone can access the care they need without fear of financial ruin. Floridians will no longer have to pay out-of-pocket fees for these essential services, leading to better overall health outcomes and a higher quality of life. In addition, the Medicare for All Act will cover long-term care for seniors and those with disabilities. As our population ages, the need for comprehensive long-term care solutions become increasingly urgent. Medicare for All will ensure that our elderly can age with dignity, receiving the care and support they need without depleting their life savings. Lastly, prescription drugs are another area that Medicare for All will significantly impact. By negotiating drug prices directly with the pharmaceutical companies, this legislation will lower low cost of medication, making life-saving drugs affordable for everyone. Floridians will no longer have to choose between buying their prescription drugs and paying their bills. We stand at a crossroads where we can continue to face rising costs, widening disparities, and millions of suffering, or choose a better future for all Floridians. Medicare for All is not just a policy, it is a promise that we value every life, that we believe in equality, and that we are committed to building a healthier and fairer society. I urge you to join me in my fight to make sure that we can actually get Medicare for All passed and implemented. Advocate, educate, and mobilize is really our motto in order to make this a reality. Let's work together to make the vision of Medicare for All a reality for not just us, but our future generations. The health and future of our state depends on it. Thank you so much for all that you do. Thank you for having me here, and stay encouraged. I truly believe that we will definitely get Medicare for All eventually if we keep up the fight. Thank you so much.
Thank you so much, Representative Cherfilus-McCormick. I think I can speak for the room in saying that we're extremely thankful for your time to speak with us tonight. And as a resident of Florida's 20th Congressional District myself, I'm so grateful for your leadership on this issue. So, Representative, I also wanted to ask, would you commit to meeting with a small group of members of Students for a National Health Program in Medicare for Florida this summer?
Definitely, I would love to. And if I may take this point of privilege, I think really what our goal is to bring everybody on board. So I love the fact that you're bringing students together, but every part of the healthcare system really has to be a part of this. And just understand that there really is room for everybody if we can all envision ourselves living in a better society. So pulling everybody, all industries, and saying, hey, look, we could design a system where we all can win and really prioritize human life, I think is the key.
Yes. Absolutely. You're absolutely right on that one. So this is so much appreciated. So I also plan now to reach out to your office regarding this. So yeah, it just really means something for us as activists to know that there are people like you serving in Washington who share our values. So once again, thank you so much for speaking to us tonight.
Thank you.
Thank you so much. So before we get to our next presenters, let me turn it over once again to our amazing leaders with Students for a National Health Program, to our next moderator for tonight, Davalda. So Davalda, over to you.
Hello, thank you so much everyone for attending our event. Thank you so much to all of our panelists. We truly appreciate your time. Hello, my name's Davalda, I go by D. And like Patrick and Atrita, our next student speakers, I am a member of SNAP and very passionate about healthcare for all. As an MPH student applying for my doctorate at FSU and FAMU, I am dedicated to fighting for affordable and high quality healthcare, and I am representing the Florida State University. I would like to share how we as everyday Floridians can take action. For example, by passing resolutions in support of Medicare for all. Our next presenters, Patrick and Atrita, are both members of Students for a National Health Program. Patrick and Atrita have worked tirelessly for the University of Florida chapter. Patrick and Atrita played a pivotal role in winning the passage of a Medicare for All resolution in Gainesville. Patrick and Atrita are going to take a couple of minutes to recap what it's like to jump into a resolution effort and how it feels to win. Thank you so much for your leadership, Patrick, for the University of Florida chapter of SNAP. We truly appreciate all of your hard work. And so without further ado, I'm going to go ahead and pass it over to Patrick and Ashrita.
Okay. I'm just gonna start here. All right. Can everyone see my screen? Alrighty, and everyone can hear me? Great. So hello, everyone. Thank you for joining us for this wonderful town hall put together by Medicare for All Florida and all of our co-sponsors. My name is Pat, and I'm a current fourth-year medical student at the University of Florida College of Medicine, going into pediatrics, and I'm joined by Ashrita.
Hi, everybody. My name is Ashrita. I'm a fourth-year medical student, also at UF, going into internal medicine. Patrick and I had the privilege of presenting a resolution in support of the Medicare for All Act 2023, and our resolution was unanimously approved by the Alachua County Commissioners last December. So we wanted to talk to you about how you can pass your own resolution in your city or county.
So why build a resolution? The biggest obstacle standing in the way for Medicare for All is profiteers. Insurance industries, hospitals, and pharmaceuticals are all profiting off a broken healthcare system and are using those profits to make sure it stays that way. We the people can't raise money like them, but we do have the people power to build grassroots movements to pressure politicians into supporting Medicare for All, and resolutions are a great way to show someone that their constituency supports Medicare for All. Another benefit of resolutions is that they're accessible to everyone with resources available here, which this presentation will be sent out after, that has sample resolutions that you can access. If you want to start a resolution to build momentum from the ground up for Medicare for All, we have all these resources available for you to do just that.
So when you're getting started, definitely consider reaching out to local organizations. Our organization, Students for a National Health Program, partnered with the Alachua County Labor Coalition, Medicare for All Florida, League of Women Voters, and Public Citizen. So any of the co-sponsors of this town hall would be a great resource to partner with. An important piece of resolution building is finding a champion in the city council or county commission who is willing to be vocal about their support for Medicare for All. From there, you can ask if other members of the board would be willing to co-sponsor the resolution so that you have more of a sway with the board, I guess. So in our case, one of our team members knew Mary Alford, who was a strong proponent of progressive healthcare reform, and she also happened to be the chair of the board of county commissioners. So you can see if anyone in your organization or on your team has a connection like this, or you can check out the city council or county commissioner members' public profiles to find your champion that way.
So after you've found your champion, it's time to write your resolution. I find this to be the easiest part, as there are numerous great resources listed on this website here for you to have sample language. It's recommended to keep your resolution at 1 page maximum and to include 1 or 2 city or county specific data. And uninsurance rates are a great place to start, which you can access here at this link. After you have finished your draft with your collaborators, it's time to send it to your champion for review and change the language as necessary to give your resolution the best chance to pass while still supporting Medicare for All. For us, we had great input from Mary Alford and all of our collaborators to make it the most inclusive legislation as possible.
So the next step, once you have the resolution written, is to prepare for the public hearing and the council vote. Sometimes those happen on the same day. It is easier to pass a resolution in some cities or counties than in others, but creating a petition, making calls to uncommitted commission members, maybe publishing an op-ed for the local newspaper, those are all great ways to show the legislators that the community supports your resolution. For specifics on how to build solidarity, we recommend working with local organizations who have passed a resolution in your area to get tips on the best way to get the word out.
Okay, and that's the basics for how to pass a resolution. Thank you all for coming, and we wish the best of luck in your efforts in passing your resolution.
Thank you so much, Patrick and Ashrita, for the presentation. We truly appreciate everything that you do for the University of SNAP chapter. So next, I am going to explain some ways that you all can get involved. So first off, I also want to give Patrick and Ashrita kudos to me, how you spoke in front of these county commissioners and they passed the Medicare for All resolution afterwards. It is inspiring to hear about. So how can you take action? Just like Patrick and Ashrita, let us know in the chat. So to join Patrick and Ashrita, other fellow medical students and healthcare professionals at the Students for Our National Health Program virtual meeting to support universal healthcare. This meeting will take place Wednesday, July 24th at 8 p.m. Type 1 into the chat to receive details via email and to join the movement next month with Patrick and Ashrita. Number 2, if you'd like to take action by asking, candidates and elected officials not to accept campaign donations from the healthcare industry with the Patients Over Profits pledge, join the Patients Over Profits campaign, asking officials not to accept healthcare industry donations. This is led by the National Nurses United. This national campaign has already secured hundreds of elected officials and candidates to sign the pledge. No experience is necessary, and training will be provided. So please type 2 into the chat to receive email information about the action call that will be taking place Thursday, June 27th at 8 p.m. Finally, if you'd like to take action, just like Patrick and Ashrita just did and explained, and you'd like to organize an event in your community to pass a Medicare for All resolution, Public Citizens Campaign provides a comprehensive toolkit and support from organizer Brittany. Brittany is the Public Citizens Energetic Organizer for Medicare for All resolutions, excuse me. Brittany will help you get connected with other activists and organizations in your city and answer any questions you might have. Join the Medicare for All Resolutions Leaders Call that will take place on Wednesday, July 10th at 6:30 p.m. Please type 3 into the chat now to receive email information on how to join Brittany on Zoom. We'd love for you to join us to take action and to attend one or more of these upcoming meetings. Next on the call, I will be turning it over to Ms. Candy Birch for the call to action on Medicaid expansion. And just a brief introduction, Candy Birch, she is the Vice Chair of Medicare for All Florida, here to speak to us about her organization for about a minute. So I will turn it over to Ms. Candy. Thank you so much for being here this evening.
I need to unmute. There we go. Thank you so much, Dee. I just want to say that my job today is really just a quick follow-up to other things, another action that people on this call can make. You have all those follow-up activities, but there's one thing that all of you on this call and other people around you could do right now. I'm here to invite you to sign the petition for Medicaid expansion in Florida. Yeah, it's another petition to change the Florida Constitution, but this one won't be on the ballot until 2026. So I'd like to, like the reproductive rights petition that this organization sponsored, we are very enthusiastic about this. So when we go to tabling events, people are always very supportive of Medicare for All and Medicaid expansion. So just last week and at the Polk Pride Festival in Lakeland, we collected 120 petitions for Medicaid expansion. And so that means that we want Floridians that means that they want to change the Constitution to make it possible. You remember in Florida, there has to be almost 1 million people who sign and get their petitions signed from all over the state, and they have to be verified. So an estimated 1.4 million Floridians who are currently uninsured could really gain health insurance through this Medicaid, if we could expand Medicaid in Florida, and that would mean that Florida would have to accept the federal funds to expand Medicaid program as outlined in the Affordable Care Act. So thank you, Angie, for putting these slides. I'm going to go right through them very quickly. The website is very easy to remember, floridadecideshealthcare.org. You go there, and then when you get there, you see the circle up there. It says sign the petition. And then at the next slide, it'll give you the opportunity to download that petition. Petitions cannot be entered digitally. They have to be up on paper thing. So down here, it gives you the opportunity to download a petition that you can print out and get that. I recommend you print out 4 or 5 so you can give some to all of your voter eligible friends as well. Next. Then you see this. When you download it, it looks like this. Now, this is kind of tricky. We need a million of them verified. So you have to print legibly. You have to make sure there are no crossouts. You can't abbreviate the name of your city. And remember, there's a part there that says county, not country, but county. And so you definitely want to be able to do as much as you can to make your petition count the very first time. Remember, we need almost 1 million to get it onto the ballot. And finally, you can mail, it says there on the form there, on the slide there, you can mail your petition and those of others around you to Florida Decides Healthcare. There's the post office box. But if you come to this part of the website, you will find all the different hubs that people have that they're willing to collect them for you. So you don't even have to do this. Ultimately, Medicaid expansion is just an incremental step to Medicare for All, but it's an important step for 1.4 million Floridians. So thank you if you've already signed it. Thank you if you plan to do it. Download it now, print it out. And so what we want is we want to get covered, and we want to make universal health care a thing to happen. So I'm happy now that we can hear from our final 2 panelist speakers for the evening. So to introduce our next speakers, I'm going to turn it over to final moderator of the evening, Mr. Sam Marquina, of Students for a National Health Program, that program has done such a wonderful job tonight. Sam, take it away.
Thank you, Candy. Hello, everyone. My name is Samuel Marquina. I'm also a second-year medical student at the University of Florida and a member of SNAP. And it's an absolute pleasure to introduce Rhonda Wallace today. Rhonda is a statewide field organizing manager with Florida Rising, which is an independent organization working to increase the voting and political power of marginalized and excluded constituencies, including Black, Brown, and immigrant communities. The issues that Florida Rising works on include healthcare and housing, among others. Every Tuesday, Rhonda brings Florida Rising members together inside of the Community Action Team. And in addition, Rhonda is a board member of Medicare for All Florida. So welcome, Rhonda, and take it away.
Thank you so much, Samuel, for that great introduction and for the welcoming space that has been provided by my peers and my fellow Floridians as well. Anyone across the state that is dealing with hardships when we talk about Medicare for All Florida. I want to tell a quick story that I didn't think I was going to tell today, but it really is going to ground everyone because this is the reason why I actually joined Medicare for All Florida. I had a really great friend in a canvasser that I walked with constantly that was always there for me, and his name was Juan Perez. As I dropped him off one day and left canvassing, he was unfortunately hit by a vehicle, and he suffered a torn liver. He did not know because he didn't have health care. He wasn't able to afford it, so it wasn't in his budget. So he went to the emergency room a lot and took a lot of Pepto-Bismol and things of that sort because he didn't know what was wrong, but he knew something was wrong. So amidst of working, of course, he decided that he needed health care and that he was going to apply for SSI. So he began to do so, and again, still working as well because he has bills to pay. And because he wasn't really diagnosed, sometimes you don't take it seriously when you feel ill. You just kind of like get through it, He was just getting through it like we would do in the brown and Black community as well, right? So It just was a surprise to me when he was admitted into the hospital. And I thought, okay, well, they're going to help him, sometimes it's a triage situation, but if it's emergency, then they'll spring into action and actually begin to do life-saving techniques to, save his life. And he didn't get what he needed. And at the end of the day, he actually passed away. And I realized that there was a absence or something missing from our society to take such a great person away that knew what he needed, and he was fighting so hard to get it, and he just couldn't get it in time. And so now I'm here. And that's what happens when one person goes, 4 or 5 more spring up. And I'm not going anywhere until I know that everyone in this country has exactly what they need when it comes to taking care of themselves and others. Because we want to always say, I want to put the mask on me first. But everyone on this call is more than likely going to put the mask on someone else before they help themselves. So I want to make sure that everyone's mask is secure. So that's my story. And then to say that it pivots to other things that are impactful in our everyday lives as well, when we fight for freedoms. And how does that look for us when we talk about women's rights right now? And again, needing Medicare for all Florida, when we talk about ABI, the Abortion Ballot Initiative. So when we talk about freedoms, and that's what a person is looking to see in healthcare in the state, and what that means to you and me, and the systems to which we enact and regale our freedoms, and what we think about freedom, and how it really impacts us. And again, how does it entail, right? What is the details laid out? Like they were saying, for a single payer, what does that mean to us? Abortion bans particularly harm lower and moderate income families and Floridians, rural communities, and the brown and Black indigenous communities as well, who already face barriers to access in healthcare and decades of racism. And again, I want to keep saying, right? I want to talk about freedom, right? Because they say we're free. Free to do what? So we need to really expand on what that freedom looks like and how that really impacts us when they say that. We have deployed at Florida Rising 95 organizers, which includes members, staff, and volunteers to reach out to swing districts, particularly focus on thousands of Black and Latino women. Floridians for Freedom is a statewide campaign, again, that amends the Florida Constitution and protects Floridians the ability to make a personal medical decision without government interference. Because what I say is, it's not the church, it's not the state. People should decide their fate. I like that part. So yes, on 4. Florida needs a constitutional amendment to limit government interference in our reproductive health and decisions and protect abortion access. And I feel like Medicare for All Florida is what we need to enact and do that as well. Floridians want the freedom to make their own personal healthcare decisions without the interference of government, the freedom to decide what is the best choice for their own bodies, their own lives, their own family. Whenever a law bans abortion for 6 weeks or 15, it puts the government somewhere that it doesn't need to be, in somebody else's business. Oops, did I say that? Right? So abortion ban denies people the freedom to control their own lives. So again, I say yes on 4. When people are denied the particular health care, not just for themselves, but their children, more likely they live in poverty and they have educational disruptions. They remain in abusive relationships and experience poor health and other bad outcomes. So again, I say banning abortion will force some people to carry a pregnancy to term and take on significant risk and life-altering consequences that come from pregnancy and childbirth. This is the freedom I ask of you today. You do the same. I ask you as a Florida Rising member and advocate to stand up with me and say yes on 4. I ask you as a Medicare for All Florida board member, and just me being Rhonda, as a mother, an aunt, just a person, to let me and my doctor make the informative decisions that we need to do when I need to do it. Don't do that. So again, November 5th is our 6-week ban, and I will say that we need to overturn that. My name is Rhonda Wallace, and I'm the statewide field organizing manager for Florida Rising and a proud board member for Medicare for All Florida. So at this time, I yield back my power. But before, I want to talk about Stefan's going to put a link in the chat. I know it happened. A link in the chat for our Super Saturdays. It also has my community action teams, which I meet every single Tuesday at 6 o'clock. I believe that we can't keep talking about things. We got to be about these things. And the only way to do that is collectively, because collective power is our only power. And again, I'm Rhonda and Samuel. Let's do this. Run this. Let's go.
Thanks so much, Rhonda. Thank you for joining us and for your words, and also for sharing your personal history you've had with healthcare injustice that affects so many societies. So moving on to this evening's final speaker, a person who's tirelessly fighting for a better Florida, State Senator-elect Carlos Guillermo Smith. Healthcare has always been a priority for Carlos. Since 2009, before his election, he volunteered with Organizing for America, advocating for the public option in the Affordable Care Act. During his 6 years as a Florida state representative, Carlos fought for healthcare expansion. Alongside State Senator Victor Torres, he co-introduced the Healthy Florida Act, a Medicare for All-like bill for our state. And he's also been a vocal advocate for Medicaid expansion, seeing it as a crucial step towards universal healthcare. Carlos is also passionate about supporting people with disabilities. In 2022, he introduced a buy-in program bill to assist the over 20,000 Floridians who are still on the Agency for Persons with Disabilities waitlist. And just this past Friday, Carlos won the election for state's Senate in Florida District 17. So we look forward to hearing about Medicare for All from him and about his healthcare plans as a state senator in Tallahassee. Carlos, the floor is yours.
Well, thank you so much, Samuel, and thank you to everyone at Medicare for All Florida for inviting me to be a part of this town hall. I feel like there's no pressure at all, considering I just went after Rhonda, who did an incredible job. No pressure after all of these amazing speakers to be last here. And thank you for the acknowledgement. Yes, this is well, I can say my first virtual town hall as the state senator-elect for Florida Senate District 17. As was just mentioned, I served in the Florida House of Representatives for 6 years. I was elected in 2016. I served 3 two-year terms in Tallahassee representing East Orange County. And this past Friday, after no other candidates from any party qualified for the Florida Senate District 17 that I'm running in here in East Orange County, I was automatically elected to the Florida Senate for a 4-year term in the upper chamber, which is really, really great. It has everything to do with, of course, people power and giving people hope that even in Florida, yes, a state like Florida, we can still elect people who care about people, who actually stand for something, and who will certainly enact the policies that are critical to improving everyone's everyday lives. We're here to talk about healthcare. Yes, it was mentioned that when I was a member of the Florida House of Representatives, I co-introduced the Healthy Florida Act, which basically is the framework to create a single payer healthcare system in the state of Florida. Very, very transformational and monumental, first ever legislation of its kind that was introduced in the Florida House and in the Florida Senate. I know that I am shocking absolutely no one on this call to tell you that the Republican majority in Tallahassee did not consider our proposal, and it was not given a committee hearing. But as I just recently demonstrated with my election to the Florida Senate without opposition, we should never give up. We should never quit. We should never get discouraged. I didn't after I lost my reelection to the Florida House in 2022, and now I'm a state senator. So that's a good example of why we should never, ever give up. And we should always stand up for what we believe in. But let me give you a quick synopsis of what's going on in the state of Florida as it relates to healthcare coverage. In the last legislative session that concluded earlier this calendar year, the Live Healthy Act was enacted and signed into law. The Live Healthy Act actually is a series of good and modest reforms to our healthcare system that help to grow our healthcare workforce and address critical healthcare worker shortages that we have in the state. It does a lot to remove regulations for the healthcare workforce. It also enhances some access to care. It increases reimbursement rates at healthcare and hospital providers around the states, and it also encourages a lot of technology innovation in healthcare. Again, nothing in this comprehensive package was particularly harmful or controversial. This was all good policy, but also it was passed with a glaring omission: Medicaid expansion in the state of Florida. Medicaid expansion, as we know, is the bare minimum, the minimum that Florida can do to substantially increase access to healthcare in the wake of either a state-based or a federal-based single-payer system. To give you an idea of what has happened, even in the last calendar year in the state of Florida, many of us know that April of this year was the last month for Florida's Medicaid redetermination process. Basically, what that means is during the COVID-19 pandemic, federal rules said that states could not disenroll individuals from Medicaid who perhaps were no longer eligible during the COVID-19 pandemic until that stay, if you will, or that protection during the pandemic was lifted or ended by the federal government. That was ended at some point in the last year and a half, where that protection expired. And so states began what is called the redetermination process, where they're taking everyone who otherwise should have been disenrolled from Medicaid because they no longer met the eligibility requirements but were protected during COVID from disenrollment. They would go through a process to basically see if they would still be eligible, or they could create temporary programs or backup programs to make sure that they could get healthcare coverage, perhaps through an alternate program. Florida did particularly terrible during the disenrollment period. We saw, unfortunately, in one calendar year, 647,000 youth aged 20 years or younger were kicked off of Medicaid after the end of that federal pandemic protection. We know so much of this had to do with red tape and paperwork not being completed properly, and people trying to call the state of Florida to try to stay eligible for Medicaid and fix some of this red tape and fix some of this paperwork, only to get busy lines, to never hear back from someone at the state. And as a result, they were pushed off of Medicaid. And we know that this impact was not only devastating for these individuals, we also know that most and the majority of those who lost coverage in the last year during the disenrollment period were children, they were parents, they were young adults, they were new mothers, and that is not acceptable. What we also discovered is that while the Biden administration made really important moves and created a new federal rule that said under other healthcare programs, like, for example, CHIP, also known as Florida Kid Care in Florida, and similar programs across the country, that states were not allowed to disenroll a child from Kid Care or from CHIP if for some reason their parent missed a premium payment. Well, Ron DeSantis and Attorney General Ashley Moody decided that that new rule was something that they wanted to oppose. And so, get this, Governor DeSantis and Attorney General Ashley Moody sued the Biden administration. They sued the Biden administration for the right to push children off of kid care if their parent misses one premium payment. Now, luckily, after that lawsuit was filed, the first judge in the first court that heard it dismissed the case and said, "No, Florida, you can not do this, and this will be the rule." I expect that just like anything will likely be appealed, but luckily for now, we understand that cruel situation where children would be pushed off of kid care for one missed premium payment is not something that will be happening in Florida. But in the meantime, as I enter my first term as a Florida state senator, I know there's a lot that we will be advocating for to expand healthcare access in our state. First and foremost, of course, we will continue pushing to expand Medicaid in the state of Florida. Why? Because we know that this will not only ensure about 726,000 uninsured Floridians if we do, so we know it's the right and moral thing to do, but also because we know that if we expand Medicaid in the state of Florida, we will be able to generate an extra $5 billion per year in federal funding from the 90% enhanced federal match for Medicaid that we will be able to get in the state of Florida. We also know that the state will save about $200,000 annually. Yes, or I'm sorry, not 200,000. $200 million annually. The state of Florida will save $200 million a year if we expand Medicaid in the state of Florida to insure those folks. That, of course, comes from higher reimbursement rates. Of course, it comes from lowered healthcare costs as a result of these high costs for uninsured folks who have to wait to go to when they are experiencing a healthcare crisis rather than having access to long-term care. We know that this is going to create savings as well as being the right thing to do. What we can also do is we can also file legislation to, at minimum, create a study in the state of Florida for what the impact of single payer will be on Florida if that was a path we decided to choose. That will give us as advocates the tools and the data that we need to be better advocates and sharper advocates. I think it's also important that we consider legislation to cap insulin at $25. We know that because of great new Biden administration policies, there's currently a $35 cap on insulin, but that $35 cap only applies to Medicare recipients. We should follow the lead of other states who have capped insulin for Medicaid recipients at $25. Look, cost controls and regulations on medications is really, really important. It's the reason why Canada has prescription drug prices are so low in Canada, because they actually enact cost controls and they regulate costs for prescription drugs in their country. That's the reason why the state of Florida put together a plan that they've spent $50 million to implement to try to import prescription drugs from Canada. They've spent $50 million on that plan to import cheap drugs from Canada, but guess what? We haven't imported a single prescription drug from Canada under that plan. Maybe we should consider cost controls the same way that Canada does to make those prescription drugs less expensive for our residents. I digress, of course. We all know that these are important reforms that need to be enacted. We will continue to champion all of these things. I wish I could tell you more about our Medicaid buy-in legislation for people with disabilities, our work to eliminate Florida's 22,000 person long waiting list for people with disabilities to be part of the iBudget waiver program so that they can live and work in their communities. But I think I have probably run out of time. And so I will commit to everyone here at Medicare for All Florida, not only to continue being a champion for these issues, but to never give up on so many of these healthcare expansion priorities that we discussed today.
Thank you, Carlos. Thank you for your words, and thank you for kind of updating us on the state of healthcare in Florida right now. One more question. Would you be willing to commit to meet with a group of us SNAP members and PNHP doctors and Medicare for All members in a small group by the end of the summer?
Absolutely. I would love to welcome you all and meet with you all. And even if that meeting has to be virtual, because I won't move into my Senate office until November, I would love to have that conversation with you all.
Thanks so much. So we'll be reaching out to you. And thank you to everyone really for joining us. When we discuss Medicare for All in a state like Florida, it's really important to consider all its communities, including those with disabilities, the uninsured, the underinsured residents too. And it's been incredible to hear about the transformative impact that healthcare expansion would bring for all Floridians. So thank you, Carlos Guillermo-Smith, for your dedication, your tireless efforts to improve healthcare for these communities and for Floridians. And I hope that everyone watching feels as inspired as I do. The overwhelming response to this town hall shows that Florida organizers have the skills and the determination to set an example for the rest of the country. One of my favorite slogans in this movement is everybody in, nobody out. That's what Medicare for All means for healthcare. To win Medicare for all of us need to be in. So if you're excited as I am, what's going to be your next step? So I'm just going to recap some of what Dee was saying earlier. If you want to join us in SNAP medical students for our next virtual meeting, go ahead and type 1 into the chat. If you want to fight against big money in politics, you can sign the Patients Over Profits pledge and type 2 to join the National Nurses United call. That's next Thursday. And if you'd like to organize in your own community and help your city pass a Medicare for All resolution like Patrick and Ashrita did in Alachua County, type 3 to join the resolution leaders call. And please send your answers in the chat right now. We'll be saving the chat log and following up with you guys afterwards. So make sure to include your full name if it's not already your Zoom name. And thank you to Representative Cherfilus-McCormick and all our speakers and all of you, all of our attendees for being here tonight. All of you represent what we're trying to build here, a society based on caring for one another and not on profit. So we will be sharing a copy of the video of tonight's recording with everyone who registered, along with the next steps that are on the screen. So thank you, everyone, and have a good night, everyone.
Thank you very much, everyone. Have a great evening.
Thank you, everyone. Have a good night.
Good night, everyone. Thanks for joining us.